You're lying in bed at 3 in the morning. Your back pain is unbearable. You can't sleep. You can't move. Your doctor gave you a prescription, but now you're wondering if you got the right painkiller. Is Tramadol really strong enough? Should you have asked for codeine instead? Today, we're going to answer this question once and for all. We'll look at the science, the facts, and the real differences between these two popular pain medications. Tramadol and codeine are two of the most commonly prescribed pain relievers in the world. Both belong to a class of drugs called opioids, as doctors use them to treat moderate to moderately severe pain. But here's the thing. People always ask which one is stronger. Which one works better? Which one is safer? The answer isn't as simple as you might think. In this video, we're going to break down everything you need to know. We'll compare their strength, their side effects, and their risks. By the end, you'll understand exactly how these medications work and which one might be right for your situation. Let's dive in. Let's start with codeine. Codeine is a natural opioid. It comes directly from the opium poppy plant. People have used it for pain relief for over 100 years. So how does codeine actually work? When you take codeine, it travels to your brain. There, it binds to special receptors called mu-opioid receptors. These receptors control how your body feels pain. When codeine activates them, it blocks pain signals. Your brain stops getting the message that you're hurting. Doctors prescribe codeine for two main reasons. First, for moderate pain like dental procedures or minor injuries. Second, for cough suppression. You've probably heard of cough syrup with codeine. The most common form is codeine combined with acetaminophen. You might know it as Tylenol with codeine. It usually comes in tablets of 15, 30, or 60 milligrams. Now let's talk about Tramadol. Unlike codeine, Tramadol is synthetic. Scientists created it in a laboratory. It's completely man-made. But here's what makes Tramadol unique. It works in two different ways at the same time. First, just like codeine, it binds to those mu-opioid receptors in your brain. But Tramadol does something extra. It also blocks the reuptake of two chemicals called serotonin and norepinephrine. These chemicals help your brain manage pain signals. By keeping them active longer, Tramadol provides additional pain relief. This dual action is why some doctors prefer Tramadol. Doctors prescribe it for moderate to moderately severe pain. This includes back pain, arthritis, and post-surgical pain. Tramadol comes in immediate release and extended release forms. The most common doses are 50 mg and 100 mg. Here's the answer you've been waiting for. In terms of pure strength, Tramadol and codeine are roughly equal. Studies show they provide similar levels of pain relief. But there's a catch. Some people find Tramadol weaker. Why? It comes down to genetics. Your body has an enzyme called CYP2D6. This enzyme converts Tramadol and codeine into their active forms. Some people have a variation of this enzyme that doesn't work well. For these people, Tramadol might feel less effective. To put it in perspective, both drugs are much weaker than morphine. Codeine is about 1/10 as strong as morphine. Tramadol is about 1/10 to 1/5 as strong. So in the world of opioids, these are both considered mild to moderate strength painkillers. Neither one is dramatically stronger than the other. Every medication has side effects. Let's compare them. Both Tramadol and codeine share common side effects. These include dizziness, drowsiness, nausea, and constipation. You might also feel lightheaded or have a dry mouth. But Tramadol has some unique risks. It can lower your seizure threshold. This means people with epilepsy or seizure history should be very careful. Tramadol can also cause something called serotonin syndrome. This happens when too much serotonin builds up in your body. It's rare but serious. Codeine has its own specific risks. It causes more constipation than Tramadol. This is a big complaint from patients. Codeine also carries a higher risk of respiratory depression. This means it can slow down your breathing, especially at high doses. Overall, studies suggest tramadol may have slightly fewer side effects. But everyone reacts differently. Let's talk about the elephant in the room. Addiction. Both tramadol and codeine are habit-forming. Your body can become dependent on them. But the government classifies them differently. Codeine is a Schedule II controlled substance in the United States when used alone. This means it has a high potential for abuse. When combined with other medications like acetaminophen, it becomes Schedule III. Tramadol is a Schedule IV controlled substance. This means it has a lower potential for abuse compared to codeine. But don't be fooled. Lower doesn't mean zero. People still abuse tramadol. Both drugs can cause withdrawal symptoms if you stop suddenly. These symptoms include anxiety, sweating, muscle aches, and insomnia. If you've been taking either drug for a long time, never stop cold turkey. Always talk to your doctor about tapering off slowly. So which one should you take? The truth is, there's no universal answer. Doctors choose based on your specific situation. Codeine might be prescribed if you have a cough along with pain. It's also preferred for certain types of acute pain. Some doctors choose it for patients who've had bad reactions to tramadol. Tramadol is often the first choice for chronic pain conditions. Doctors like it for patients at higher risk of constipation. It's also chosen for people taking antidepressants, though with caution. Your age matters too. Codeine is not recommended for children under 12. Tramadol has similar restrictions. Your other medications play a role. Your medical history is crucial. The bottom line? There's no clear winner. The best painkiller is the one that works for you with the fewest side effects. Before we wrap up, here are some critical warnings. Never take tramadol and codeine together. Combining them increases your risk of serious side effects. Both drugs interact with many other medications. Be especially careful with antidepressants, anxiety medications, and muscle relaxants. Alcohol is a big no. It multiplies the sedative effects and can be dangerous. Who should avoid these medications? People with severe breathing problems should stay away. Those with a history of drug abuse need to be extremely cautious. If you have liver or kidney disease, these drugs can be risky. Pregnant women should avoid both medications when possible. They can affect the developing baby. Breastfeeding mothers need to be careful too. Both drugs pass into breast milk. Always tell your doctor about every medication and supplement you're taking. Let's recap what we've learned today. Tramadol and codeine are roughly equal in strength. Both provide effective pain relief for moderate pain. Codeine is natural while tramadol is synthetic. Tramadol works through two mechanisms. Codeine has higher abuse potential. Tramadol may have slightly fewer side effects. But both carry risks of dependency and side effects. So what's the final answer to our question? Neither one is definitively stronger or better. The right choice depends on you, your pain, and your medical history. Never make this decision on your own. Always consult with your healthcare provider. They know your full medical picture. If this video helped you understand these medications better, hit that like button. Subscribe for more health content. And drop a comment below. Have you taken either of these medications? What was your experience? Thanks for watching. Stay informed and stay healthy.